Hi, my name is Paul. Welcome to my presentation on my audit and research SSM. So for some background on my project, I began by looking at how COVID-19 affected Operation Throughput in the gynae department at the Royal Derby Hospital. So as we know, COVID-19 affected all hospital activity, mainly elective surgeries, but the ripple was felt across all aspects of clinical work. And this combined with an increase in NHS waiting time highlights the importance of maximizing surgical throughput. So to meet these increasing demands, it is essential that the number of operations returns to pre-pandemic levels. So the aims and objectives of this project was to analyze surgical throughput from 2018 to 2023, which will allow us to establish the impact of COVID-19 and if the numbers have returned to pre-pandemic levels or if they've not. This will then allow us to determine what needs to be put in place and make recommendations so to help the numbers return to pre-pandemic levels and also assess what did go wrong and what is still not happening, that the numbers aren't where they need to be. So the method for this project, the data was collected from the ORMIS database from the Royal Derby Hospital Gynecological Department. The number of operations between the 2nd of January 2018 and October 2023 was collected, analysed, and broken down by year and also by month. COVID-19 had the biggest impact on the years 2020 and 2021. So therefore, data from these years aren't compared, but they're still presented in this project just because they are kind of the anomaly, because as we expect, COVID affected these years the most. So it wouldn't be fair to compare them. So for the total number of operations, we saw that it has decreased from 3,193 operations in the year 2018 to 2,183 operations in 2022, which is a 32% decrease. As you can see in the graph, 2020 had the lowest amount of operations, as that is when lockdown happened and when COVID had its biggest effects on the NHS. So this graph breaks down the number of operations per month. So the average operations per month was 266 in 2018, and it reduced to 182 in 2022, which also is the 32% decrease that I explained. As you can see, in March, when the lockdown began, that's when the Operation Throughput completely fell and was at its worst. And then since then, it's steadily risen, but not risen back to pre-pandemic levels as seen in 2018 and 2019. So from this, it highlights that the effect of COVID-19 on surgical throughput, and it confirms that the number of operations per year has not returned to pre-pandemic levels. So potential factors which could be affecting this or causing this is if there are less consultants in the department, or if the operations are taking longer, perhaps due to increasing complex cases, or perhaps less experienced surgeons which are taking more time during the operations. However, there could also be other factors such as administration issues, any logistics, patient cancellations, for example, or if there are any policy updates in the department which could slow down the amount of operations which are happening per day. So analysing each of these aspects will provide answers to why surgical throughput has not returned to pre-pandemic levels. So that's something we have also looked into, and something we're going to look at in the next slide. And then also, in addition to this, it would be useful to re-audit in 2024 for the current year numbers in 2023, as in the previous slides I've compared 2018 to 2022. That's because we have not the data for 2023 ended in October, so it would be useful to see the full data from 2023 next year when it's available. And then we can find out if there's any trend, whether it's an increase in number of operations getting closer to pre-pandemic levels, or if it's just remaining the same. So then we looked at the number of surgeons operating, and we found that there was a decrease, less surgeons operating. So there was a 20% decrease from 2018 to 2022. So there were 76 in 2018 and 61 in 2022. And then we also looked at overall theatre time and surgical time. And we found that both of them have increased, but the percentage of surgical time in theatre remains consistent, indicating that all aspects of operating times have increased. And there was an increase in surgical time from 46 minutes in 2018 to 64 minutes in 2022, which is a 39% increase, which is quite large. So based on this, some recommendations going forward would be to increase the number of operating surgeons to pre-pandemic levels, or find out why the number has fallen and isn't rising again. Look into any potential factors which are increasing theatre and surgical time. So, for example, any policies that have been introduced. Look at how many cases per day are happening, what time they're starting, what time they're supposed to be starting, etc. And then also, as I've mentioned, audit again next year to assess any up-to-date trends. So some other data that we've also looked at, we have types of operations during 2020. So we've compared the emergency operations and elective operations, and then we've compared them to 2019 pre-COVID. So we can look at the difference in how COVID affected the type of operations that were happening. The average age of patients during 2020, and that is also compared to 2019, and then for similar reasons to see the effect COVID had on the average age of patients. And then we've also done the number of TLHs done per year, and then we broke that down into per month as well. And then we also did the number of TLHs broken down by surgeon per month. And then we also have the average TLH surgical time per year, and then we've also broken down the average TLH surgical time by surgeon per year as well from 2018 to 2023.